Thank you so much, Sonal, and thank you, Yosi, Digvijay, everybody. It's always a pleasure to talk at Yosi, and everybody knows Yosi is very close to my heart. And this is also another topic which is very close to my heart. Uh, just give me a minute. Yeah. So, how to get your thesis right? It's been over almost a decade since I did my thesis, and then have supervised some after that. But still, like I said, it's a topic that I speak fondly about. So to begin with, why do we need a thesis and why do we need this talk? So your thesis is essential for passing your post graduation exam, be it your MS, MD, or your DNB. And it's your first exposure to the scientific method. We've been talking about reading papers, about writing papers, and thesis. There's no better way rather than doing a thesis to get to the bottom of it. It gives you an opportunity to present and publish. Like all the other research work that you do is optional, but this is necessary. And this might help you decide whether it is your cup of tea or not. And of course, if done properly, your thesis is an important contribution to the academic community. So, on a lighter note, you all have to suffer like we also suffered. Each and every person who is a postgraduate has done a thesis, and hence the trend is passing on. So very quickly, these are the headings under which I will be dividing my talk. Selection of the topic, your thesis protocol, then how you actually carry out your thesis, how you write it, and what more can you do with it. So the topic is very important, and this is why the first section is dedicated to it. And it's kind of ironical because you're just a week or a month into ophthalmology, and your guide tells you to go and find a topic for your thesis, whereas you might be even not knowing exactly what the specialty is, which diseases are covered in that specialty. So we'll get to that part a little later, how you can take help. But these are some guiding principles, which can help you decide a research question. The finer criteria. So your research question, what you're going to do your thesis on, should be first of all feasible. So you should be able to carry it out in your institute in terms of the number of patients, in terms of the equipment and the expertise that you have, in terms of the affordability of the patient of the institute, and it should be manageable for you to complete within the timeline that has been allotted to you. Of course, it should be interesting, novel. Now, even the guide expects you, and you also think that maybe you'll think of something which has never been done before, but that is usually rare. So, you can settle in for even confirming or refuting previous findings, or extending previous findings, or like I said, if you get a novel idea, then providing new findings. It should be ethical, wherein your seniors will definitely help you to decide, and it should be relevant, what we call the so what test. So don't just, like the previous speaker was saying, don't just do research for the sake of doing research. It should be a topic which adds something to the community. Now, the topic should be relevant and timely. So, think a little ahead of time, because you will be submitting your thesis after 2 years. So the topic should still be relevant and timely at that time. It should be practical and doable, like I said, and it can build on previous research or expand knowledge. So you can kind of take on a previous study and, extend it forward. Many a times it so happens that your guide has done a couple of theses on a particular subject, and then you can just add to it to add to the literature coming from your institute on that topic. And like I said, rarely you can be doing groundbreaking or cutting edge research wherein everything becomes much easier. So to get a good topic, it is essential to do a thorough literature review, because you might think of a topic and you might think it's very good, but then if you have not done the research properly, the review properly, you might not realize that the exact same study has already been done, and that will naturally limit the scope and the applicability of your own study. So a thorough literature review is very important, and then you can brainstorm with your colleagues, with your seniors, with your guide to come up with a topic. Now, the topic should clearly define these criteria, the PCOT, which we say, the population, the intervention, if you have a comparison or a control, the outcome, and finally the time. Now, next, coming to the thesis protocol. Again, I use the word dreaded because you are just into ophthalmology. You are learning how to use the indirect and the slit lamp. And on top of it, you have to submit a protocol which has to get accepted and start your thesis. So this is a standard format which most institutes used with, there can be some juggling here and there. I'll start with some useful tips. Like I said, talk to seniors, talk to postgraduates of the same guide, because it's likely that you will get a topic in the same field, and involve the statistician early on. This is a mistake many people do, that they involve the statistician only when they start writing the thesis or interpreting the results. But you should consult a statistician earlier to decide the sample size and the test that you are going to use. And like I said, a thorough literature search is important. So arm yourself with the internet, with PubMed, Cochrane Library, all these. Get savvy with these tools, because you will keep need to doing literature search all throughout, not just your post graduation but your career as well. Getting full text can sometimes be a challenge if your institution does not have access. So DOS, AIOS, and all these organizations can help you to get passwords. Now, you start with the introduction, where you describe the condition you're talking about briefly, what is known, what are the gaps, and how your research question would add to the body of knowledge. Now, remember, even in your protocol, you should write in paragraph form, and there should be no bullets or no subheadings. Next, you come to the review of literature. Now, there is no need to go into the very detailed pathophysiology, etc. Talk about what is relevant to your topic, and more importantly, summarize the studies which are related to your research question. Then identify the lacunae in literature, and finally, that will lead you to the rationale for your study. So the ROL should be comprehensive yet relevant. Do not include textbook material. Like if you have a thesis on diabetic macular edema, don't start talking about diabetes and how it affects each and every organ. Try not to use articles which are more than 30 years just arbitrarily. Give headings and subheadings so that it's clear in your mind also. And this is very important, as was talked earlier. Do not copy paste, read, and then shut that article and try and write it in your own words. So make rephrasing a habit to avoid plagiarism. And you should start referencing side by side, and not wait and then put 30 references together. The references mostly should be in Vancouver style. And then again, cross-referencing should be avoided. Cite only those where you have actually read the full text. And you can make use of reference managers such as EndNote, Mendeley, and Zotero. So next, coming to the aims and objectives. Now, what is the difference between these two? The aim is basically the bigger issue or the bigger question which your study addresses, whereas the objective is actually putting it down. It is more smart, like we say, specific, measurable, achievable, realistic, and time bound. I think you'll understand this with an example. So for example, our aim in a study was assessment of the macular function in acute CSC, but our objectives were divided into primary and secondary. And here we further characterized it into multifocal ERG, and then correlation with visual acuity, contrast sensitivity, and thickness. So your objective is much more measurable and tangible. This is a list of things that should be included in your materials and methods in order for your protocol to be accepted, in order for your thesis to be standardized, and later on in order for your paper to be published as well. So I mean, this is a list you will find, or you can just click it. Coming to the sample size, as I said, involve a statistician to get to this. And always remember that even though your thesis duration might be 2 years, but you need a follow-up also. So try and target a population sample size which you can collect within 6 to 12 months. Only then you will have the requisite follow-up, and take a little extra to account for the attrition rate. And this is the second part the statistician will help you with, the test that should be used. And this again should be written in your thesis. If both these are not written in your thesis protocol, it will be sent back for modifications. And finally, the approval letter from the institution ethics committee. By and large, if your guide has approved it, this should not be a problem, but this is essential. And now, even for papers being published in the reputed journals, this institutional ethics committee clearance or approval is a must. This is your operating manual on which you are going to carry out your thesis. Now, coming to the third part, which is actually planning and monitoring your thesis work. So again, I'll start with some tips. For the one of the challenges is to get patients. So what you can do is make like a short placard or something of the patients you want and display it on the in the relevant OPDs or in the clinic so that you get the referral. Sometimes consultants might forget, faculty might forget. So, just write like diabetic of this age with this much vision, kindly refer to this number or whatever. The second thing I would advise is, as soon as you recruit the first patient, make a performa for each patient, fill it and file it. Okay. And you can also start filling your master chart in Excel side by side. So this later on, you will not get burdened. And also you always have an idea of how many patients you are done with, how many have been lost to follow up, where exactly you are in your thesis. And finally, this is something especially for like retina investigations, which I always tell my students: retrieve your data and photographs as soon as possible. Machines do crash and you wouldn't want to lose valuable data because of this misfortune. So once you collect the data, you organize it, then you present it in tables and graphs, then you analyze it along with your statistician, and finally you interpret it. So just even at the start of your thesis, the importance of ethical work cannot be overemphasized. Common issues are not taking informed consent, not maintaining confidentiality of data, and very commonly, we are lured into fabricating or falsifying results as an overburdened PG. But it is something you should consciously stop yourself from doing, because it may become a habit and you do not want to start your research journey this way. Plagiarism, of course, has been talked about and is to be avoided at all costs. There are free plagiarism checkers. So even if you feel that you have rephrased something, you should still check, because you might be using phrases even subconsciously if you haven't copied pasted, which can account for plagiarism. So just honest errors or differences in opinion does not amount to misconduct, but fabrication, manipulation, hiding or omitting bad results or duplicating results, all these do. And if you get caught, of course, there's nothing more disappointing and shameful for yourself. So stay away from all of this. Now, finally, coming to writing the thesis, and this is again a challenging part. So actually, if you have written your protocol well and done your thesis well, the only extra thing which you have to write in your thesis are the results and the discussions. The results are quite simple, because you just have to state what you have found in the categories which you have mentioned in the outcome measures. So basically, you just have to put in the numbers, the quantities, or the qualitative data, whatever you have collected, and you have to tabulate it or portray it in the form of graphs. So it is the discussion which actually interprets your results. So here you summarize your results, then you compare it with previous studies and state differences, then you postulate or give explanations, and finally you must always include some drawbacks of your study, like the design, the number of patients, and how it could have influenced the outcome. And then you get down to the implications and applications, which are actually your conclusion. So this is what comes out of your study and not of the previous studies that have been done. So this is actually the spine of your thesis, I would say, the discussion, and you should take ample time to write this in close discussion with your senior faculty or your guide. Finally, your thesis requires to have a summary and recommendations, which should ideally be standalone, as in if anybody reads it, they should know what you have done, why you have done it, what you have found, and how it is relevant. So again, just to lighten the mood, a lot of time is spent in thinking about your thesis, in worrying about your thesis, in editing and formatting, rather than actually writing your thesis. But if you have, on a serious note, planned your schedule in such a way, you will do it in time and you will do justice to each of the sections as and when required. So like I said, while writing the protocol, you must must pay attention to the statistics, to the materials and methods. And once you're writing the thesis, the discussion is probably the most important part. So a well-written thesis has attention to grammar, punctuation, otherwise it puts a bad impression on the person who's reading it, attention to detail, and then in the appendix you should have all the questionnaires, etc. So the last part, what more can you do with your thesis than just submitting it and as a prelude to your degree? So your thesis is literally your baby, and this is your fallback for any presentation that you want to do on a state level, national level, international level. And don't wait for your final thesis to be over before you present. You can always present interim analysis with permission and discussion of your guide. You can enter into competitive sessions like the AIS Young Researcher Award, which I was lucky to get way back in 2011, and it opened up a whole new avenue for me. I sponsored a trip to the academy, which was almost like a new world for me, and this was all thanks to my thesis and my guide. Of course, you can publish your entire thesis as an original article, but even if you can't do that for whatever reason, you can always take out case reports from the patients in your study, or case series, or you can even write letters to the editor on topics which have been related to your study. So thesis, if done the right way, is not a burden, is definitely not boring, and can be the beginning of a career involving research. It can take you to new heights. So this is something you should spend some time on. Thank you for your hearing.